In this episode of Ask the Doc, got a great question from Mary on Instagram that's been dealing with a shoulder problem for 2 years that has not been properly diagnosed and wanted to know if they should do an X-ray or an MRI. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems down the road like pain pills, injections, and surgeries, which only make things worse. Back at it for Ask the Doc. I'm going to read the full question. It's a really good question. It says, I have been dealing with chronic shoulder pain for going on 2 years now and did the typical route of anti-inflammatories, rest, ice, and then 6 weeks of PT. The problem continued to get worse to the point where it's keeping me awake every night. Recently, my PCP, primary care physician, ordered an X-ray that came back as negative and really no answers. They offered me to just go back to PT and offered a cortisone shot. I feel like I actually need an MRI, but the insurance company won't approve it until I do more PT and an injection, which I know won't work. My question is, how can they make the judgment just off an X-ray? Wouldn't an MRI tell a lot more? Any advice would be great, especially what I can say or do to get this MRI approved, because I can't handle being in all this pain and losing so much sleep. Thanks for sharing that, Mary, and very sorry to hear you're dealing with this. We get these all the time, and I've been very open and honest about why the current medical model just sucks. It's not set up for success, it's set up for failure, and all the insurance companies are trying to do is to deny you the care that you need and keeping you from getting the treatment that you actually need, but they got no problem cashing your premium checks every month. It's a broken system. Another issue you're going to find here is that your primary care physician, they're just not equipped to handle injuries. They don't get a lot of training in school in musculoskeletal injuries. I think it's less than like 20 hours. They're dealing with a lot of other stuff, like heart problems, diabetes, depression, anxiety, all these things. They are not equipped to handle a complex musculoskeletal injury, and usually what they want to do is just offer you some anti-inflammatories and injection, go to PT. They don't really want to deal with it because they're not equipped there. So the PCP is probably the last person you want to have try to figure out your injury. They just don't have the tools for it. Next one is just physical therapy just made it worse. Yeah, it did. Of course it did, because you don't know what the problem is. You can't fix a problem if you don't know what it is in the first place. And this is what happens with physical therapy. They just jump right in, say, oh, something's tight, something's weak, there's bursitis, let's just stretch it, let's strengthen it. You really don't know what's going on. Imagine if you brought your car to the mechanic and the mechanic was like, hey, we're not going to bother running some diagnostics. We're just going to get in there and start banging away, start hammering on stuff, and you don't really know what's going on. They would never do that, but we do this with our bodies all the time. Another thing is X-rays, honestly, are just, they're pretty useless, especially when it's chronic injuries and really trying to figure out what's going on. So what I wanted to link up first in this week's Ask the Doc is an awesome video from my wife, who actually works together with me in our clinics, and she explains the difference between an X-ray and an MRI and why getting an MRI is way more important. So I'm going to link that video up first.
X-rays are a giant waste. Hi, I'm Dr. Danny Homer, the clinic director here at Peak Injury Solutions, where our mission is to make chronic injuries obsolete. So today we're going to talk about why X-rays are generally a huge waste of time and money. So first things first, X-rays do a good job of looking at the bone. So if you think that you might have a fracture or a tumor, then an X-ray might be a good way to rule out those two things. But if your problems are stemming from somewhere else, the soft tissue, the joint, cartilage, a disc, then an X-ray is not going to help. So X-rays can make a lot of assumptions about what's going on in the soft tissue, and some providers out there will even tell you things about the soft tissue, like you have muscle tears or joint degeneration or disc herniation based on your X-ray. And that's complete nonsense, because you cannot see those things on an X-ray. So the good thing about MRIs, which is what we would prefer to have people get, is that it will show fractures, it will show tumors, it will show the joint, muscles, tendons, ligaments, and it's all in a 3D. So imagine if you wanted to have something tangible in your hands and look at it and examine it. Someone made a Xerox of it and gave you in one hand, and someone made it a 3D printer in the other hands. That's the difference between an X-ray or a Xerox and a 3D printer or an MRI, is that you can see all the different areas of it. So it's a much better diagnostic tool, and typically the x-ray is just a waste of time and a waste of money. So if you've been suffering with a chronic injury and x-rays aren't giving you the answers you need, which isn't surprising, then you need to get to a soft tissue expert and get an MRI and get the diagnosis dialed in so you know how you can get fixed.
So I hope you got something out of that video, something educational, help you learn a little bit more. A couple take homes from the video and just from this whole Ask the Doc video this week is, number one is you have to take action in the process of your health, and you have to be an advocate for yourself when it comes to getting your problem fixed and solved, because the insurance companies aren't going to do it, the doctor isn't going to do it. You have to be the one that takes charge, does your own research, educates yourself properly about what's going on. Number two, this doctor isn't ordering it because they don't want to have to jump through the hoops. There's a lot of paperwork they have to fill out. They got to get on the phone with somebody. They got to waste a bunch of their time, and they're too busy to do that. This is why it's not getting approved, and you shouldn't expect your doctor to do that either. They got other things to do, and they don't have the time to do this. Next is the entitlement idea of insurance. So what does entitlement mean? Basically, we think because we have insurance that we are entitled to really awesome care. From a doctor's perspective, this is what happens to the doctors when they go and network with these insurance companies. Basically, what happens is the insurance company says, hey, you're only allowed to do these certain things, and we're only going to pay you this certain amount for what you do. So imagine if you went to work tomorrow and your boss said to you, hey, you know what, I'm going to need you to do the same amount of work, but I'm going to pay you 50% less. You tell that boss to go screw off. But this is what happens with the doctor. So what they have to do is they have to see more people, hire more staff, their margins get tighter, and they can't focus on you as the client, and you're just going through the rat race of just feeling like you're just a number in the practice. The next thing I always talk about is this idea of like traditional insurance is kind of like if you commit a crime, you get access to the public defender, which is okay, but they're probably going to bumble your case. They're not going to really be able to fix it. If your life is truly on the line, you're going to shell out the money to get a really good specialized attorney that's a defender, and they're going to get you fixed and go from there. This is what happens in healthcare too. If you just use the people that are taking the insurance, they're like the public defenders. They're going to cost you more. They're not going to fix the problem, and they're going to make it worse in the long run. So understand, when you invest with someone that doesn't participate in insurance, they can focus on you better. They can help you get results, and they don't have all the bullshit that's just stuck with being an in-network insurance provider. So a couple action steps. Number one is just pay out of pocket for the MRI. Load up on your HSA card, health savings account card. These are really good. You can get them through most health plans, and you put money in there, and you can even get some breaks in taxes, and the money rolls over. Pay out of pocket. Number two is go to a private or outside imaging center, especially not one affiliated with a hospital, and ask them what their cash rate is for an MRI, because if the doctor writes you a script for the MRI, they can take it wherever, and the cash one is actually going to be better because a lot of these places aren't as busy, and they're willing to work with you on a cash rate and pay out of pocket. And lastly, don't expect the broken system to save you. It's not. You have to be an advocate for your own health, take charge of what's going on, and understand paying money for good quality service is going to help you get the results that you need. That's all I got. If you like the video, share it with others. If you have any questions you want me to cover on the Ask the Doc series, send them in. I'm always happy to help. And lastly, just get out there and take full responsibility for your health, because no one else is going to care more than you will. If you're dealing with a problem, maybe you got a neck, shoulder, low back, hip, sciatica issue, you've been dealing with it for at least 6 months, you've seen at least 2 other providers, and you're running out of hope trying to figure out if you can actually get a resolution for this injury, reach out to us and get yourself hooked up with a peak method trained provider. They're the best in the world at finding and fixing injuries that other practitioners can't. You get access by one of them with all the information written below, or you can send us a direct message wherever you're consuming this. Appreciate you guys watching, and we'll see you on the next one. Bye.